Vitamin B12 deficiency symptoms that should never be ignored. Welcome to our comprehensive guide on vitamin B12 deficiency symptoms that should never be ignored. In this video, we will delve deep into the topic of vitamin B12 deficiency, exploring its symptoms, causes, and potential complications. By understanding the signs of this deficiency, you can take proactive steps to address it and prevent any adverse effects on your overall health. Understanding vitamin B12 deficiency. Vitamin B12, also known as cobalamin, is an essential nutrient that plays a crucial role in various bodily functions. It is responsible for maintaining the health of your nerve cells, DNA synthesis, red blood cell formation, and energy production. While your body requires only small amounts of vitamin B12, its deficiency can lead to significant health issues if left untreated. Common symptoms of vitamin B12 deficiency. 1. Fatigue and weakness. Feeling tired and weak, even after adequate rest, is a common symptom of vitamin B12 deficiency. 1. This happens because cobalamin is involved in the production of red blood cells, which carry oxygen throughout your body. 1. Insufficient vitamin B12 can result in decreased oxygen transportation, leading to fatigue and weakness. 2. Pale or jaundiced skin. If you notice a pale or yellowish tinge to your skin, it could be a sign of vitamin B12 deficiency. 2. The inadequate production of red blood cells due to cobalamin deficiency can lead to a condition called anemia, which manifests as pale or jaundiced skin. 3. Shortness of breath and dizziness due to reduced oxygen supply caused by vitamin B12 deficiency. You may experience shortness of breath, even during light physical exertion. 3. Dizziness and lightheadedness can also occur as a result of inadequate oxygen reaching your brain. 4. Tingling sensations and numbness. Vitamin B12 plays a crucial role in maintaining the health of your nerve cells. 4. When deficient, you may experience tingling sensations, numbness, or pins and needles, feeling in your hands, feet, or other parts of your body. 4. These symptoms can be indicative of nerve damage caused by a lack of cobalamin. 5. Cognitive and mood changes. Cobalamin deficiency can affect your cognitive function and mood. 5. You may experience difficulty concentrating, memory problems, confusion, or even depression. 5. These neurological symptoms can be distressing and should never be ignored. 6. Digestive issues. Vitamin B12 deficiency can lead to digestive problems such as constipation, diarrhea, loss of appetite, or even weight loss. 6. If you notice any unexplained changes in your digestive system, it is essential to consider the possibility of cobalamin deficiency. 7. Mouth and tongue problems. Oral symptoms like a sore tongue, mouth ulcers, or a burning sensation in the mouth may indicate a lack of vitamin B12. 7. These issues can be uncomfortable and interfere with your ability to eat and speak. Causes of vitamin B12 deficiency. Now that we have explored the symptoms, it is essential to understand the underlying causes of vitamin B12 deficiency. The most common factors contributing to this deficiency include: 1. Inadequate dietary intake. Vitamin B12 is primarily found in animal-based foods such as meat, fish, dairy products, and eggs. 1. Individuals who follow a strict vegan or vegetarian diet are at a higher risk of developing a deficiency since plant-based foods do not naturally contain vitamin B12. 1. In such cases, supplementation or fortified foods are often recommended. Causes of vitamin B12 deficiency. 1. Impaired absorption. Certain medical conditions can interfere with the absorption of vitamin B12 in the body. 1. One such condition is pernicious anemia, an autoimmune disease that affects the stomach's ability to produce a protein called intrinsic factor, necessary for B12 absorption. 1. Other gastrointestinal disorders, such as celiac disease or Crohn's disease, can also impact B12 absorption. 2. Medications and surgical interventions. Long-term use of certain medications, such as proton pump inhibitors, PPIs, or metformin, can affect the absorption of vitamin B12. 2. Additionally, individuals who have undergone gastrointestinal surgeries, like weight loss surgeries or bowel resections, may have a reduced capacity to absorb B12. 3. Age-related decline. As we age, our bodies may experience a natural decline in the production of stomach acid and intrinsic factor, both of which are necessary for proper B12 absorption. 3. Older adults, therefore, are more susceptible to developing vitamin B12 deficiency. 4. Chronic diseases. Certain chronic conditions, such as kidney disease or HIV/AIDS, can contribute to vitamin B12 deficiency. 4. The underlying mechanisms vary, but these conditions can affect the body's ability to absorb, store, or utilize B12 effectively. Complications of vitamin B12 deficiency. If left untreated, vitamin B12 deficiency can lead to severe complications that affect your overall health and well-being. Some of the potential complications include: 1. Neurological disorders. The neurological symptoms associated with vitamin B12 deficiency, such as numbness, tingling, and cognitive impairment, can worsen over time and lead to irreversible nerve damage. 1. This can result in conditions like peripheral neuropathy, which can cause pain, muscle weakness, and difficulty with coordination. 2. Pernicious anemia. Prolonged vitamin B12 deficiency can lead to pernicious anemia, a condition characterized by a decrease in red blood cells due to the body's inability to absorb B12. 2. This can result in fatigue, shortness of breath, chest pain, and an increased risk of heart problems. 3. Increased risk of cardiovascular disease. Vitamin B12 deficiency has been associated with an increased risk of cardiovascular disease. 3. Inadequate levels of B12 can lead to elevated levels of homocysteine, an amino acid linked to heart disease. 3. Maintaining optimal B12 levels is crucial for heart health. 4. Pregnancy complications. Pregnant women with vitamin B12 deficiency are at a higher risk of developing complications, such as preterm birth, low birth weight, and developmental issues in their babies. 4. It is crucial for expectant mothers to ensure adequate B12 intake to support their own health and the healthy development of their babies. Preventing and treating vitamin B12 deficiency. Fortunately, vitamin B12 deficiency can be prevented and treated with appropriate measures. Here are some strategies to consider. 1. Balanced diet. Ensure that your diet includes foods rich in vitamin B12, such as meat, poultry, fish, eggs, dairy products, and fortified cereals. 1. If you follow a vegetarian or vegan diet, consider incorporating plant-based sources of B12 or opt for B12 fortified foods or supplements. 2. B12 supplements. If you are unable to obtain sufficient vitamin B12 from dietary sources alone, consider taking B12 supplements. 2. Consult with your healthcare provider to determine the appropriate dosage and form of supplementation that suits your needs. 3. Regular checkups. Routine health checkups can help identify any deficiencies early on. 3. Include B12 levels in your regular blood tests to ensure optimal levels of this essential nutrient. 4. Address underlying conditions. If you have medical conditions or gastrointestinal disorders that may affect vitamin B12 absorption, it is essential to work closely with your healthcare provider to manage these conditions effectively. 4. This may involve medications, dietary modifications, or other interventions to optimize B12 absorption. 5. Lifestyle modifications. Certain lifestyle factors can also impact your vitamin B12 levels. 5. For instance, avoiding excessive alcohol consumption and quitting smoking can positively contribute to your overall health, including B12 status. Conclusion. In conclusion, recognizing and addressing the symptoms of vitamin B12 deficiency is crucial for maintaining optimal health. From fatigue and weakness to neurological complications, the effects of B12 deficiency can be significant if left untreated. By understanding the causes, symptoms, and potential complications, you can take proactive steps to prevent and treat vitamin B12 deficiency. Remember, maintaining a balanced diet, incorporating B12-rich foods, considering supplementation if necessary, and addressing any underlying conditions are essential for ensuring adequate B12 levels. Regular checkups and open communication with your healthcare provider are key in managing your health effectively. If you suspect that you may be experiencing symptoms of vitamin B12 deficiency, we strongly recommend consulting with a medical professional for a proper diagnosis and guidance tailored to your specific needs. Don't ignore the signs. Take charge of your health and well-being.